to the videos what I have been taking up in general pathology. So today's video we'll be discussing about a very important short note or a long answer question, that is about necrosis, and in necrosis we'll be discussing about the coagulative necrosis. So students and viewers, beginning with, so whenever the word necrosis means, it is seen that necrosis is a term used to define that there is cell death occurring, and whenever in a particular tissue certain cells are dying, so that cell death is ultimately going to cause the degradation of that particular tissue, because if a group of cells are dying, so that is going to ultimately lead to the cellular degradation, and if cell dies, that is going to cause cell degradation, and later on when the cell degrades, it is seen that these cells on degradation they release certain hydrolytic enzymes, and these hydrolytic enzymes ultimately cause the necrosis of that particular tissue and organ. So in this video we'll be discussing about the coagulative necrosis, which is also called as ischemic necrosis. Why? Because coagulative necrosis, it is most commonly seen that this coagulative necrosis is due to sudden cessation of blood flow. So whenever in a particular organ, if in any organ it is found that the blood flow is getting hampered, the blood supply is stopped, and there is impairment of blood supply, so in such a case this kind of coagulative necrosis or ischemic necrosis occurs. So if there is sudden decrease in the blood supply or sudden there is ischemia in that particular tissue or organ, so this kind of the necrosis what occurs, it is the coagulative necrosis. So in the coagulative necrosis the most commonly involved organs are the heart, kidney and spleen, and just because there can be there is sudden cessation of blood flow, there is sudden stopping of blood flow, so this kind of a necrosis is going to cause the cell death in a localized area, and later on the cellular degradation is followed by the release of hydrolytic enzymes by the cell, and later on it will lead to inflammation. So the most commonly involved organs are heart, kidney and spleen, and here are the sites where this coagulative necrosis can be seen. So there are so many causes of coagulative necrosis. Among them, the most important cause is ischemia, that is there is sudden cessation of blood flow, there is sudden stoppage of blood flow in that particular tissue or organ. Now apart from this, there can be so many other reasons, such as in cases of certain bacterial infections, for example diphtheria, infections of diphtheria, as well as the bacillary dysentery infections, the coagulative necrosis can be seen. Apart from this, there can be certain chemicals, that is mercuric chloride. In earlier days, these mercuric chloride infections, these chemical agents were being used. So these chemicals also cause coagulative necrosis. But out of so many causes, the most important cause for coagulative necrosis, I am emphasizing that it is ischemia, that is sudden cessation of blood flow or sudden stoppage of blood flow, which is going to cause necrosis in that tissue or organ. That's why the coagulative necrosis, it is also called by another name, which is called as ischemic necrosis. Now in coagulative necrosis, what is occurring? There is an irreversible cellular injury. And you have already said there is sudden cessation of blood flow is there, sudden stoppage of blood flow is there. So the injury, what is occurring is a sort of an irreversible injury, because the blood supply is hampered to that particular tissue and cells. So ultimately the injury what occurs, that will be a completely irreversible injury, and that the tissues and cells cannot revert back to the original state. So is it clear? So what happening is there is sudden cessation of blood flow, which is ultimately going to cause the irreversible cellular injury, and this That's why it is most commonly seen in heart, kidney, and spleen. This coagulative necrosis is most commonly found in such organs. And when we look at the pathology, now when we discuss about the pathology, how this coagulative necrosis is visible. So initially, the grossly necrosed tissue, in the initial time, in the early stage, it is going to appear pale, firm, and slightly swollen. The necrotic tissue, the grossly necrosed tissue, is going to show pale, firm, and slightly swollen appearance in the early stages, and this, in the early stage, it was called as an infarct. So the necrosed tissue is going to appear in such a manner that it is going to have a slightly lesser color, that is, it becomes pale and firm and slightly swollen in the early stages, and at this stage it is called by the name what is called as the infarct, because there is infarction occurring, there is cessation of blood supply, there is stoppage of blood supply. So that particular region of the tissue is going to be called as an infarct area. Now moving on, later in the later stages, what do we find? Later on, when there is ischemia, it is an irreversible cellular injury. So the later on, the tissues will become more firm, they will become more yellowish, softer and shrunken, which is later on, if the necrosis will progress to such a sort of a thing. So in the later on, the tissues become soft, firm, softer, firm, yellowish, and shrunken. So this has been seen in the pathology. So how the gross necrotic tissue is occurring in the early stages, and how the gross necrotic tissue is occurring in the appearing in the later stages. Now we move on to the hallmark. So students and viewers, do remember, very, very important, I am discussing that in the histopathology, in oral pathology or in general pathology, you are supposed to write about the microscopic examination as well. Now in the microscopic examination, when such tissues is visualized under the microscope, it is found that the conversion of normal cells into tombstones is occurring. Now, this is very, very hallmark for coagulative necrosis. The normal cells are going to transform into tombstones, which means the cell outline is preserved, whereas with the degradation of cytoplasmic and nuclear components. So the cytoplasmic component of the cell as well as the nuclear component of the cell is going to show degradation with the preservation of the cell outline. So if it is a columnar cell, so the margin of the columnar cell will be preserved. If it is a cuboidal cell, the margin of the cell outline of the columnar cell, the cuboidal cell, any of the cells, the margins is going to be preserved. But the cytoplasmic details and the nuclear details of such cells is lost in coagulative necrosis. So this type, when the cell outline is preserved with the degradation of cytoplasmic and nuclear components, so such a condition, it is called as the tombstone appearance of cell. So this is a tombstone appearance. Along with this, the necrotic cells, they are going to show three important characteristics when it comes to nucleus. The nucleus shows karyolysis, means there is dissolution of the nucleus with the nuclear chromatin material. There can occur dissolution. There can occur karyorrhexis, means the chromatin material in the nucleus is going to fragment, it's going to disintegrate into smaller pieces. So that is karyorrhexis. And pycnosis can be seen in this such a kind of a necrotic cell, and this pycnosis occurs, that is, there is condensation of the chromatin material. The chromatin threads becomes more condensed, so the nucleus becomes more pycnotic. So the three characteristic important nuclear findings in coagulative necrosis is karyolysis, karyorrhexis, and pycnosis. Now, most importantly, when you are going to observe any cell under the microscope, what do you find? That the cells needs to be stained. Now, in such a cell where necrosis has taken place, the cytoplasm is going to be more eosinophilic. So the cells of the cytoplasm cells, the necrotic cells, they will stain more deeper. So more eosinophilic color will be seen. They will be more eosinophilic with more staining as compared to the normal cells. There will be greater eosinophilic deposition in the necrotic cells. Now, later on, when we see eventually at the last, the necrotic cells, what are there? They are necrosed, and later on, what do we find is that there is infiltration of the inflammatory cells. So the infiltration of the inflammatory cells will occur to further disintegrate the cells, causing the release of hydrolytic enzymes. And the dead cells, what are ultimately remaining, the remnants of the dead cells, they are phagocytosed, and the phagocytosis of the granular debris and the cells, they are cell fragments, leading to the formation of the granular debris and the cell fragments. So there ultimately the inflammatory cells will come into action. They are going, the necrotic cells will be infiltrated by the inflammatory cells. The cells of inflammation will come, and eventually the dead cells will be phagocytosed. So students and viewers, this was a very short video where I've tried my level best to give you in simple terms that what is coagulative necrosis, what is the hallmark of coagulative necrosis when it comes to microscopic examination, what are the causes, and how is the pathology, how it is gross examination on grossly the necrotic tissue, how it appears, and later on how the necrotic tissue appears in the later stages. So students and viewers, this was a very short discussion where I've tried my level best to give you in simple terms what is necrosis and what is coagulative necrosis. So students and viewers, if you like this video, give this video a thumbs up. Those students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.